I'm Donna Sanders, and I'll be doing a case presentation of my cardiac patient, and a review of his medications. So this is Mr. T. He is a 53-year-old male. He is a non-smoker, does admit to an occasionally having a beer, and he has history of arthritis in his wrist and his knees, and in the hands area, and he also has a long-time history of heartburn, which he takes Tums for. And then 9 months ago, he had an MI, so he went into the cardiac cath lab and had angioplasty done and had 3 stents placed. So previous to this, about 3 months before the MI happened, he actually got a full physical where his EKG was normal. He was in normal sinus rhythm, didn't have any arrhythmias. His blood work was good, except for he had borderline hyperlipidemia, and his vital signs were good, so he didn't have any hypertension or any palpitations or anything like that. No reason of concern before the MI. This is a list of Mr. T's medications, both before and after the MI. He still takes the Tums. He still takes the Advil. He says he occasionally has heartburn, so he still takes the Tums. Advil, he usually just takes for the arthritis pain. He usually takes 1 to 2 tabs, 1 to 2 times a week, depending, how much he needs it. He's also on Carvedilol, 3.125 milligrams PO Q day. This is a beta blocker that keeps his heart rate under control and his blood pressure. He's on Torvastatin, 40 milligrams PO every day. This is for the hyperlipidemia. He is on 2 antiplatelets, aspirin 81 milligrams and Xarelto 10 milligrams, which he both takes. He takes both of those every day, just 1 time a day. So this is called a dual antiplatelet therapy, and there's reasons that they have this combination because they work a little differently. And then there's the Brilinta, which is an anticoagulant. He takes 90 milligrams a day, BID. So side effects, you can see here that there are quite a few side effects. Carvedilol, there's always going to be that chance that you're going to have hypotension with it, but and a cough. It does affect the blood sugar, so you have to watch that. Torvastatin, abdominal pain, constipation, nausea. And then Brilinta, aspirin, and Xarelto, anytime you put a combination of this many antiplatelets and an anticoagulant together, you're going to have an increased chance of prolonged bleeding, but it could lead to severe reactions like difficulty breathing and swallowing. And of course, Tums, any reaction you have is going to be GI side effects. And then Advil, Advil put into the mix, there could be nausea and vomiting, diarrhea, constipation, but there also could be side effects of ringing in the ears. Next, we'll talk about actual side effects. So he, so far, has, when I listed all of these, the only thing that he really complained was, he said the only thing he has side effect was the increase in increase in bruising. And in the beginning, he had nosebleeds, but he said he's not had a nosebleed since probably the first month he started taking it. So, but the bruising, he said he still has a lot of bruising. So he's been warned about doing any kind of activity where injury might occur, so he's been educated on it. Drug interactions, there's both potential drug interactions when you have this many medications put together, and you can see that the list is kind of lengthy. Advil decreases the antiplatelet effect of the aspirin. Brilinta and Advil each increase the actions of the other, and then all the way down to Tums interferes with Carvedilol absorption, so that has to be monitored. Carvedilol, aspirin, and Advil together increases potassium levels, and then of course again when you put these 3 together, Brilinta, Xarelto, and aspirin along with the Advil, you're going to have the increased chances for the bleeding and the bruising. And then at the bottom you'll see that there are some minor interactions there that relates to patients that have renal insufficiency, so you have to be careful about that. So Mr. T, he is very compliant with his medications. He always sets his medications out a week ahead of time, and he sticks to a nice strict regimen. He said he didn't have any problems taking them. His vital signs have been controlled. He has no arrhythmias. He's not complained of any palpitations. His blood pressure's been good. He has been back to the doctor one time since he started on this medication, and the doctor actually has kept him on it. Usually at the 6 month point, they take you off of some of the anticoagulants, but his cardiologist decided to leave him on it. It'd be good to note here that any cardiac people know this, that when you have an MI and you're in the hospital, most of the time you're put on every time I've took care of a patient, they've been put on an ACE inhibitor. He was put on an ACE inhibitor in the hospital. He was put on a very low dose of lisinopril, but his blood pressure could not, they couldn't maintain his blood pressure above 90 systolically. So the doctor decided to go ahead and send him home on it. So a week later he came back. He complained of dizziness, fatigue, and lightheadedness, and so the doctor removed it from his medication list. So he's no longer on lisinopril. He hasn't needed it. His blood pressure's been fine. As far as affording his medications, he doesn't have any problems. He has insurance, which covers 100% of his medications, and I know this many medications put together can be very expensive for patients, and it can deter them from taking the medication. If you can't afford it, you can't get it, you can't take it. So he's been very blessed with that. The only thing I see is that maybe he might need some education on the Tums and the Advil when combining it with the prescription. He does realize that Tums does not need to be taken at the same time that he takes his medications. He's talked to his doctors, and he doesn't take Tums enough to have a prescription strength, but there might be the chance that might need to happen eventually, maybe. And then, of course, the Advil. Advil tends to raise your blood pressure, and then it increases bleeding. So that needs to be maybe a little bit more education done on that when combining it with his already 2 antiplatelets and an anticoagulant. So that is